Welcome to day 17 of my COVID-19 recovery. Today I wanted to talk about some of the things that I've seen people say when they see that someone has contracted the COVID-19 virus. There have been a lot of people I know even, and strangers that when it gets reported that somebody has contracted the virus, people will say, it's just another flu. Or they'll say things like, and there's a 99% chance that that person will be just fine. And there's a lot of errors in that kind of flippant attitude towards this pandemic. As somebody who has had coronavirus, I will tell you that it is not just another flu. And it's sort of like playing Russian roulette, uh, saying that somebody will be just fine. It's probable that they'll be fine. You can't count on that. There's too many people dying, and even if a person does not die of the virus, there's still other things that go on. So, for example, I'm forever concerned about what this will mean for the future of my health for the rest of my life. I have not researched a whole lot about this yet. I need to get into it. Just haven't had the energy to look into it, but I have heard on stories on NPR that they are just now starting to learn about uh, in different tests and different studies. Uh, there have been a lot of people where it looks as though their organs have aged rapidly after contracting COVID-19. And I think they're still early in studying this and they don't know much about it yet. And so I know that when I'm aware of my body and the how I'm feeling inside, I know that there are things that have changed that I can't really explain. I can't really put words to it, but I don't feel like I used to. And I don't know if that's going to go away. There's a lot of questions I have, even though I was very fortunate to have very simple, mild, less than mild symptoms of COVID-19. That also may not be the case for somebody else that I might have infected. If I went out and infected somebody else, they might respond very poorly to recovering from COVID-19. They may not recover. It could kill them. That's why I had to isolate immediately. And that's why I wish that I had isolated a little bit sooner when I first got symptoms. There is very little evidence that I have infected somebody else, but I also have to deal with the fact that I don't know that. And that's on me. And so this is not, when you hear that somebody has contracted the virus, a proper response is wondering what are the odds that they're going to infect somebody else, and what are the odds that other people might have a bad bodily response to the virus. It might even kill them. It's bad enough that it makes people sick. I don't want to make anyone sick for even a minute in their life, right? Let alone, God forbid, somebody dies. So that's how we need to think about it. We need to have an attitude of, sure, maybe this person might recover well, maybe they're in good health, but what about those that they might infect? They may not. This is something that spreads. You can't just think about what's in front of you, and you can't just think about your own comfort and what you don't want to do or what you are willing to do and what you're not willing to do. You have to think about others. This is all about this is a giant exercise in our society about how well we think about others and what we're willing to do, the lengths that we're willing to do to the lengths that we're willing to go for keeping other people healthy and safe. That's what this is about. I don't wish this, as light as my symptoms were, I don't wish this upon anyone. And especially because it will spread. It multiplies. This thing multiplies. If you don't isolate immediately, this thing does spread to other people. And every case is different. So you have to think about that. That's the attitude that we all need to have. We need to protect each other's health, not just our own. We need to protect each other's comfort, not just our own. We need to realize that this thing spreads and that it doesn't just stay with one person. So isolation is vital, and not everyone can isolate. Think about single parents that cannot isolate. we need to make sure that those of us who can isolate, we do it. And we go to the extra mile to make sure nobody else gets this thing. And that when somebody does get it, we don't just shrug it off. That shows who we are on the inside, right? That shows how much we really care about those around us, is how we react to something like this. So please think about others. Think about how this spreads. If you have symptoms, if you can, isolate as much as you possibly can. I realize that not everyone has the resources that I had to isolate. Isolate as much as you can. Get tested as soon as you can, and ask for help. You need plastic cutlery, disposable plates and cups, so that nobody's washing your dishes after you've used them. You need to keep your garbage. If you're isolating, you need to keep your garbage in your own receptacle, in your own isolation room. I could go on and on and on. You've heard me say all this before. But this is about others. Remember, this is about others. Please stay safe. Think about others. Stay healthy. Stay at home. Wash your hands. Wear a mask. Wear 2 masks. Do what you can for the sake of others, not just yourself. See you next time.